you're watching this video, congratulations on your pregnancy. You have many exciting times ahead and of course many nerve-wracking ones as well. But one of the things you definitely don't want to be concerned about is your health insurance. So let's talk about pregnancy and health insurance in today's video. Pregnancy is a time that requires a tremendous amount of medical care. There are so many doctor's visits and blood tests and ultrasounds and additional diagnostic imaging and more. Now, if you are considering going without health insurance for your pregnancy, please know that prenatal care without insurance tends to hover somewhere between $2,000 to $3,500. However, labor and delivery without insurance is where things can get really, really expensive, often upwards of $15,000. And remember that 1 in 3 women in the United States deliver via C-section, which can push you over $35,000 without insurance. Now, luckily, prenatal and breastfeeding support is guaranteed under the Affordable Care Act, so there are plans available to you that will offer you quality coverage. So yes, under the ACA, prenatal care is required of all marketplace and group health insurance plans, and routine prenatal care must be offered at no additional cost. However, the language can be a little bit unclear as to what exactly routine care is. For this reason, we'd highly recommend that you work with a broker. If you do have questions, you can reach us in the comments below or at the number on the screen. We're licensed nationwide and there's no charge for our services. And of course, we release these videos on a weekly basis, so please make sure to like and subscribe to stay up to date. Now, routine care under the Affordable Care Act must include things like breastfeeding support and counseling, birth control, folic acid supplements, gestational diabetes screenings, gonorrhea screening, hepatitis B screening, maternal depression screenings, preeclampsia prevention and screenings, very important, RH incompatibility screenings, syphilis screenings, expanded tobacco intervention and counseling, and urinary tract or other infection screening. And of course, this is in addition to your regular prenatal visits and labor and delivery. Your regular prenatal visits and these services are covered with no additional copayment or coinsurance, even if you haven't met your deductible. So your actual regular care leading up to labor and delivery will be covered. There will, of course, be a cost for the actual labor and delivery. But again, some carriers may offer better benefits than others. So marketplace plans, in addition to those group health insurance plans, must offer prenatal care. Unless your plan was somehow grandfathered in before the Affordable Care Act, but that's highly unlikely. We'd recommend that you contact your company's HR department if you do have insurance through your employer to determine the extension of your benefits. Now, if you or your spouse was recently laid off, then you may still be eligible for prenatal care through COBRA. Again, this is something that you definitely want to contact your company's HR department about. If you don't have insurance through your employer, I'd highly recommend you check out the marketplace for insurance options. You can enroll every year during the open enrollment period, which is November 1st to January 15th. If you make sure to enroll prior to the end of December, then your insurance would become active as of January 1st. Remember, there are no more pre-existing conditions. Pregnancy cannot be considered a pre-existing condition under the Affordable Care Act, so you cannot be denied or charged more. However, in most states, becoming pregnant doesn't qualify you for a special enrollment period. Make sure to check out healthcare.gov because that has changed ever so slightly as of recently. But again, in most states, that would not make you qualify for a special enrollment period. So if you are outside of the open enrollment period and you need health insurance for your pregnancy, then I'd highly recommend you look into Medicaid. There are certain financial criteria that you may have to meet, but generally speaking, pregnancy Medicaid is a lot more available to most people than regular Medicaid. You may also qualify for the CHIP program, which is the Children's Health Program, so I'd recommend that you check out Medicaid.gov for more information there. If you're unable to enroll in any of these types of insurance, please don't give up hope. Please call a broker. There may be other qualifying life events that may make you eligible for a special enrollment period. For example, very often the denial of Medicaid makes you eligible for a special enrollment period through the marketplace. There are other personal decisions that you can make as well. For example, choosing to pay in cash for a nurse midwife or nurse practitioner as opposed to your regular OBGYN may save you money. Again, entirely a personal decision. There are also free clinics and clinics like Planned Parenthood that can offer you health care. But whatever you do, please do not wait to book your appointment. And I cannot stress this enough, because many OBGYNs and even midwives will not accept new patients after 20 weeks. And you absolutely need to be with a doctor or a healthcare provider that you can trust. So please do not wait past 20 weeks. And remember that the birth of a child will always qualify you for a special enrollment period. So you can look ahead to the future to determine what marketplace plan you might like to enroll in after the birth of your child, or even an additional Medicaid program or CHIP at that time. If you have any questions, you can reach us in the comments below or at the number on the screen. Again, there is no charge for our services. We're more than happy to help. Please make sure to like and subscribe to stay up to date. And if you'd like to learn more about those marketplace plans, I'd recommend you check out this video over here. As always, thank you so much for watching and have a wonderful day. Bye-bye.